Great. Yanima to everyone. Hopefully you can all hear me. Welcome to the breakout session on COVID-19 and impact on mental health. It's lovely to see so many of you here joining us. Hopefully you can all see my screen. My name is Zara Kanji. I'm a counseling psychologist in training and a board member with the Aga Khan Health Board. And I will be moderating this session with Rina Koradia, who is a family and systemic therapist and chair of the Healthy Minds team. All of the breakout sessions today will be recorded and will be made available to the Jamaat at a later date. This session will last until 3:30, so we'll first have a 20-minute talk, followed by an opportunity for questions at the end, after which we will all rejoin the main group. If you do have any questions, please ask them via the chat function, and we'll try our best to address them at the end. It's a great pleasure to introduce our speaker for this session. Dr. Asif Bachlani is a consultant psychiatrist and joined the Priory Group in 2019 as Hospital Medical Director for Priory Hospital Woking and Oxford Wellbeing Centre. Since joining, Dr. Bachlani has become Clinical Director for Priory Acute and PQ network of hospitals. Prior to joining the Priory, Dr. Bachlani worked as a community adult psychiatrist and held various clinical and managerial positions in NHS trusts, including Associate Medical Director, Trust Lead for Mental Health Outcomes, and Chief Clinical Information Officer. In 2016, Dr. Bachlani was awarded Health Foundation Award for his project entitled Improving Physical Health Care for Patients with Psychosis. Dr. Bachlani was also the NHS London Clinical Lead for Mental Health Outcomes for 2 years, where he co-authored HLP training modules. He has also been involved with the Royal College of Psychiatrists and is currently the Finance Officer of the General Adult Faculty, having previously been an executive member. Dr. Bachlani's current focus is to ensure clinicians have access to high-quality data to enable better patient outcomes, and as he has given talks at various trusts on why data matters for clinicians. I would now like to hand over to Dr. Bachlani.
Thank you, Zara, and I'm sorry for the rather grandiose bio. So I'm showing you my Twitter profile mainly because I might be slightly negative about social media a bit later on in the talk, but actually I'm a really big fan of Twitter. So next slide, please. So going to start talking about what's happened with mental health and mental health services since the start of the pandemic back in March, and what impacts patients have noticed, what impact mental health services have noticed, and I guess a bit about what's going to happen as we're kind of heading into our potentially second lockdown. Next slide, please. So most of us will remember that from about Nowruz in March that our lives changed significantly, and what we were asked to do and what we were able to do had changed. So Zara, next slide, please, sorry. And so what you'll see in the survey, this was an ONS survey done in May, but covering the April and May 2020 of 2,500 people, of which 50% responded. So that's a pretty good response rate. So 1,200 people responded. You can see a significant proportion of people are worried about the impact that COVID has on their life. Over 50% of people are feeling anxious or stressed, and even 50% are feeling bored. So there is, and obviously there's an impact of restrictions and not being able to go back to work and other things on people when they first started. Also in June 2020, we started getting a sense of the differences of what's happening with people with COVID. So initially, the feeling wasn't it, that actually everyone gets affected by COVID the same, but in reality, we all know that's not the case now. And so when we're looking at health and mental health, then we saw that actually it was the greatest problems were in children and young people. Yes, as we can go back to the previous slide, that'd be really helpful. People who are in low income, urban populations, families with children, and people with mental illnesses. So potentially people with mental illnesses were already a impacted group, and their health and mental health worsened at the beginning of the COVID outbreak. And again, stats that were carried out showed that generally people's mental health had worsened within the population 8%. And if I talk about our personal experience when I was working as an inpatient psychiatric consultant, what we noticed interestingly in March and April, which was a bit of a surprise to me, was actually people with mental health problems weren't coming to the services, but actually what we noticed was a massive increase in people coming with addiction problems, so with alcohol problems and illegal drug problems. And why was that? Well, actually, if you remember correctly, all the off-license were closed. So actually, one of the interesting things was people weren't able to get their booze, drug lines were closed, so you weren't able to get the drugs. So a lot of people were actively withdrawing and coming in for addiction programs. And that was really interesting. And I guess I hadn't thought about that. And I wonder if that's, again, if people remember, after a week or so, all the off-license opened. And I wonder if that was because of the health consequences of people acutely withdrawing. So that was something that we weren't expecting. And I guess what we were expecting were increase in mental health referrals, but that hasn't happened for quite a long time. And I'll talk about that a bit later on. Next slide. So the Health Foundation produced a report in June, and that looked at factors which affect people's mental health. And perhaps this list won't surprise you at all. Social isolation and being disconnected. We are social animals, and not being able to connect with our family and friends is a major issue. Although interestingly, the people who were kind of socially isolated didn't change. The overall numbers are roughly 5%, which is 2.6 million people. But perhaps it's the type of people who are socially having to isolate which change. And these were predominantly people, working age adults living alone, those in poor health, and those in rented accommodation. Probably most of us have heard that there's been a massive problem with domestic violence. And in the first 3 weeks of lockdowns, the end of March, 1st of April, we had 14 women and 2 children die due to domestic violence, and a 50% increase in calls into domestic violence helplines. Obviously, most of us were really very worried about our job and finances and housing instability, all of the things that are kind of core to keeping us well or keeping us safe and feeling us secure. So a third of people were worried about losing their job. 12% of people have no access to private or shared gardens. So if you can imagine that, it's been stuck in a flat for months on end, not knowing when it's going to finish and not having any access to greenery. That must have been extremely difficult, and it was extremely difficult. And interestingly, Black people were 4 times more likely not to have access to a garden. So there, you can start to see the differentiation between the different populations within the UK. And so for most of us, what are our coping mechanisms? Staying in touch with friends and family, outdoor exercise and work. And of course, if you're not able to do these things, then that's obviously going to adversely affect our mental health. Next slide. So on this slide, you'll probably see things that you have done and I have done, and potentially people that you know will have done at least. So we've all used things like Zoom or FaceTime calls or WhatsApp calls as a way of staying connected with our family. And actually Zoom's popularity has gone up thousands, hundreds of thousands of percent, because actually we all want to stay connected. And again, some of you might have been a bit more impressive with their physical health and done the Joe Wick stuff, but this was really well set up by Joe and helping all sorts of children at 9 o'clock, and it helped to develop our day-to-day routine. And then within the NHS and how we communicate with ourselves within our trusts or our organizations, Teams took off significantly. And this is a quote from NHS Digital from May 2020, which is 500,000 messages are sent by Microsoft Teams. So you can see that there's been a significant shift, at least within healthcare professionals, within big organizations using digital. Next slide. So one of the things that was been also proven a bit difficult for people is reduced availability to mental health services. So next slide. So I guess I don't know the proportion of people who have kindly joined us today to talk about mental health, our healthcare professionals and those that aren't healthcare professionals. If you work for an NHS organisation in the UK, you'll have access to data, and obviously Prof, the talk before talked about the importance of data. Data is vital as a clinician to help you to improve services. So this is NHS benchmarking data, and this is looking at the beginning of the outbreak between April and May and showing the impact of what's happening in local mental health services. So you can see from this that there was a 13% reduction in referrals from GPs to adult mental health services. For CAMS, it wasn't as much, but it's still a significant amount, so that's 11%. And actually even self-referrals, they kind of increased from family members, both in adult and CAMS services, but interestingly, referrals from urgent and crisis centres increased, not hugely, but 3% for adult, but significantly more for CAMS. And I think the way I've interpreted that is people were genuinely scared for their life and scared of dying. And so people who had perhaps more mild or moderate illnesses, they were kind of suffering in silence, struggling on, and only when things got really bad would they go to A&E or kind of go to their GP and get referred in. And also, it probably wasn't very easy to go and see your GP right at the beginning of the pandemic until we all kind of got used to using things like telephones and digital. And that sounds a bit funny considering all of us have got WhatsApp and FaceTime, but we haven't predominantly used that as a way of interacting with patients, at least in mental health services, where it's always been kind of face-to-face. Next slide, please. So if we talk about where we're at now, so that's kind of earlier on in the pandemic, what's going on now? So next slide. So this was, I'm going to show you a couple of things sort of published just recently in September, again showing where we are with our mental health. So next slide, please, Zara. So in this kind of article, what it shows is almost 20% of us are struggling with depression in June, comparatively to sort of 10% in March. And what's ended up happening is people have, as I said, struggled on, kind of trying to do the best that they can, not really gone to the GP, not been able to go to the GP, felt that they're not as supported by their kind of community mental health group, and I think potentially have got worse. But then also I think what's ended up happening is the prolonged stress and the prolonged uncertainty has increased people's mental health problems, be it both depression and anxiety. And again, there is a proportion of people who are more adversely affected. So younger people, those with disabilities, key workers, there's even been a sense that key workers, i.e. hospital or social care workers, a lot of them are going to really suffer from PTSD a bit further down the line when things are kind of calming down again. A vast majority of adults, sort of 90% are saying they're experiencing some sort of depression or anxiety, and 40% of people with relationships are being affected. And this on the slide now is the Guardian article from a couple of weeks ago, again in September, which showing us as psychiatrists are seeing, we're seeing 43% increase in urgent and emergency cases. So again, people are not feeling comfortable getting help, or they can't access help quickly, and because of that, they're ending up going into a crisis, and then either going to A&E or going to crisis teams. But unfortunately, it's getting to such a point that they're in a crisis before they're kind of seeking help or being able to access help. And there's also been a concern that's been increased in suicides because of this reason. And they estimated in this article in September, a couple of weeks ago, that 500,000 people will experience mental health illness. I'm going to show you a slide a bit later on, which actually says it's going to be significantly higher than this. So again, just to show you a bit of data, again, next slide, Zara. What you'll see, this is again NHS benchmarking data, and it's looking at community-based teams, so adults and older adults, so basically 18 plus. And in essence, what it can show you is that referrals dropped by 43% in April. I mean, that's a significant drop in referrals. Just to give you a sense, the bar charts are 2020 and the line is 2019. So a significant drop in referrals. And what you can see is it's gradually getting back to normal. And obviously this is slightly old data up to about July 2020. But but referrals into secondary care, into kind of specialist mental health teams is still 10% lower than this time last year. And anecdotally, there's also information to say the proportion of patients who are on mental health services caseloads have also dropped. So people really aren't getting the kind of support and help that they need. Referral rates, which is the second kind of bar chart and line, is and so referral acceptance rate. So once you're referred, are you accepted on the team? That's pretty similar, but you can see people are struggling to get the help that they need. Next slide. So I was fortunate enough to be involved in a talk a couple of weeks ago, and we had a patient talk about their experience as well as other patients. And he chose to engage with patients via Twitter and ask them how easy or difficult is it to get into mental health services. And in essence, what patients were generally saying is they were finding it very difficult. They're asking for an emergency appointment, and then normally with an emergency appointment is you'd kind of get a response within 5 or 7 days. And obviously this particular individual didn't get support until 3 months later. People are self-harming, considering ending their life or having significant suicide attempts, and still finding it very difficult to access support, which is obviously not what we want to do as healthcare providers and healthcare professionals, but people are really struggling. Next slide, please. I guess one of the things I would also say that is I found a little bit surprising, again, given the fact that we're now doing a conference on Zoom, we are all on our FaceTimes and WhatsApp video calls, is how the NHS has really struggled to use digital. And if you go to the kind of blue bits of the graph, that's adult services, so that's where I work. You can see from April to June, there's been a 2% increase in using of digital. So that's pretty poor. And you heard Prof. Munir talk about actually that there's going to be a huge rise in telemedicine and video medicine, but actually we haven't seen that in mental health services. So the question I ask myself is, again, is this patients, and is this patient's choice, which is completely fair enough, or is this us as healthcare professionals not feeling very comfortable with digital and not taking it up? And I suspect it's a bit of both. Absolutely, patient choice is important, and some of my patients don't want to do video calls and want to do telephones, and that's absolutely within their right. And of course, we should go with what people's choices are. But I'm not even convinced people are even given the choice. And I guess on a personal level, as a medic, I would always prefer the medium of face-to-face. But if we don't have that luxury, then my second choice would always be video. But I don't think we're very good at it. CAM services, so 0 to 18, they are much, much better. They started off at 11% and they jumped up to 22%. So they had like a 200% increase, whereas adult services were pretty poor. Other bits of services you can see have done much better than general adult services. So IAPT, which is primary care, psychology is also pretty decent at 17%. Next slide, please. So we have all tried to keep connected via Zoom and WebExes, and probably most of us as healthcare professionals spend our lives doing this stuff when we're doing things within organizations. So I think we're pretty good at that. Most meetings have moved from face-to-face to digital. But again, I don't know what people have noticed, but I've noticed that actually I find it much more difficult. It's difficult to kind of gauge people's emotions as well. And also I find at the end of the day, I get significant headaches. So you kind of get this Zoom fatigue. So although it's really important to stay connected, actually there are consequences of that as well. Next slide, please. So this is often how I feel after a whole day of meetings with Zoom, like give up, please. So again, it's important to think about what patients want. And again, the next couple of slides just talk about what patients have felt. So this particular individual had what we call a care planning approach meeting, which is a meeting that one does at least once every 12 months, normally with a nurse or an occupational therapist and a psychiatrist and the patient and carer. But they felt rather paranoid, and they didn't like the video call kind of experience. And actually, they had problems with technology, and we had problems with technology. And actually, they'd rather face-to-face or telephone. And of course, we don't really have the luxury of face-to-face nowadays, so it ends up being telephones. Next slide, please. Another patient said, well, actually, I didn't really feel that I was listened to very well, and they were missing cues. And actually, they found the experience of having 2 or 3 people talking to them via Zoom or Microsoft Teams very difficult. So again, I think patient choice is really, really important. So next slide. So I guess it's then thinking about, we are now 6 months, next slide please, Zara. We're not about 6 months down the line. And so what are we expecting to happen? So next slide. So this is data from NHS Confederation, the Mental Health Network, and it basically asks professionals, if you fast forward in the next sort of 3 to 4 years, 5 years, where do you see the greatest expansion of need? And you've got 4 different domains here. You've got acute services, which is sort of general hospital for my way of looking at things, mental health, community services are things like district nurses, community nurses and things like that, and then obviously GPs. And then what you can see is that there's a massive green bit in mental health. So healthcare professionals think there's going to be a significant increase in mental health problems and mental health referrals coming down the line due to the pandemic. And I think this is almost certainly true. And I'm just going to show you the next slide, which kind of backs this up. So this is Centre for Mental Health, which published this 2 days ago, actually almost beautifully timed for this talk, to basically say there's going to be significant increase in proportions of people needing mental health problems. So they're estimating that an additional 8.5 million adults will need mental health input. I mean, that's a massive number, yes? So that is, in addition to what we have currently, another 8.5 million. So our population in the UK is about 60 million. So that is what, an eighth of the population? So that's what, getting my numbers right, about 15% increase in mental health problems due to the pandemic in the next sort of couple of years. And a significant proportion of children and young people also having mental health problems. And actually, in many respects, it's significantly harder for children and young people to access mental health problems because the demand far outstrips the kind of supply. So I guess I realized these last 2 slides were a bit pessimistic. So I wanted to kind of leave on perhaps slightly more optimistic or a slightly of a can-do attitude. So what can we do to keep well? Next slide, please, Zara. So perhaps obvious things to say, but sometimes I think even as healthcare professionals, we kind of forget what the obvious things are. So next slide. So sleep's absolutely vital. Having a good night's sleep is really important to keep well. There was a survey done about 10 years ago that showed if you presented with sleep problems to your GP, 60% of those people would have either depression or anxiety. So although you can give people medications to help them with their sleep, if their fundamental problems is depression and anxiety, actually you need to treat their depression and anxiety. So obvious things, don't use your iPad or phone an hour before bedtime. A study done in Sheffield with young children showed if you compared stopping somebody using their iPhone or iPad comparatively to a sleeping tablet that you give children, which is called melatonin, the melatonin gives the child 15 minutes, stopping using your iPad or phone an hour before bedtime gave you 90 minutes. So it's a significant proportion of extra time of sleep. Obvious things, don't have a TV in your bedroom, have a routine. I'm a big fan of mindfulness, and I would strongly encourage people to do mindfulness before they go to sleep. The other thing that has become absolutely clear, if it wasn't beforehand, is we're creatures of habit. Structure is really important. A lot of us, that's work that provides that structure. But if we can't go to work, then actually having a similar structure at home, as much as possible, is really helpful. So on a very basic level, planning something to do in the day, planning something to do in the afternoon, have meal times roughly the same, have bedtime roughly the same. Exercise, if you can, is also vitally important. During the day, keeping healthy, also can help with sleep. And as I've mentioned before, we're social animals, so we like to keep connected. And so, although I would say be wary of social media and things like Facebook and Instagram and potentially even Twitter, actually keeping connected via video calls actually is really important, and it's an important aspect, especially if you're living on your own or you don't have very much sort of family locally that you can visit, or you don't drive, all those sort of things. Actually, it's really important. Next slide, please. And then if one starting to get unwell, mentally unwell, what would you do? And again, perhaps this is obvious to most of you, but just to kind of set it out, there are lots of online resources. There you can go to various charities such as Mind or Rethink. Another good place that I found quite helpful is Head Talks. And Head Talks was set up by a guy that used to work for the Gordon Brown kind of government, and he had mental health problems. And he's got lots of self-help kind of videos, even for young people, and mindfulness. So that's a really good one to go to. And you just need to put Google and Head Talks. If things are getting into the more kind of moderate range, then you could think about going to your GP, who could arrange counselling or psychological work or medication. They might also suggest kind of self-help books, and there's various self-help books. There's a series called Overcoming, so overcoming depression, overcoming anxiety, overcoming low self-esteem, overcoming OCD. You just put the word overcoming and the illness that you want, again, in Google or Amazon, you can find a book. There's also a really good self-help CBT book called Mind Over Mood. That's also a really good book. You can then obviously go to IAPS, which would offer you different types of therapy, group-based, one-to-one. And then obviously if things are getting into kind of the more moderate to severe end of spectrum, then you end up having to see a psychiatrist and a kind of a psychologist, and having particular types of therapy. Next slide. So again, I wasn't sure about the mix between healthcare professionals and sort of general public, but again, there was specific help for healthcare professionals. And doctors or healthcare professionals are significantly higher risk of having mental health problems, having drug and alcohol problems, and we need to get help. So there's a standard route, GP, IAP, referral into CMHT. There's lots of options of where else you can get help from the Royal Colleges. So this is the Royal College of Nursing, but whatever Royal College you're in, OT, psychologists, medics, you'll find that. Also the unions, such as the BMA or BDA or other unions that you're in, the Royal College of, other unions that you're part of, they can also offer you support. Then again, if your indemnity insurers, they can also offer you support. So there's the Medical Protection Society, the Medical Dental Union, all sorts of different sorts of organizations can offer you support. And then again, the final option would be the practitioner health GP surgery. And that's run by Claire Girardia. And Claire used to be the president of the Royal College of GPs. And that's a service that you can get referred to, you can self-refer to. And that is a group of GPs, psychiatrists, and counsellors who are specifically trained in order to support healthcare professionals. And I guess the obvious thing is don't suffer in silence and get help. Next slide, please. So the last thing is I guess just to kind of bang on the drum about mindfulness again. So I'm a really big fan of mindfulness. I haven't always been, I got persuaded by my wife that mindfulness is a good idea. And as a medic, I kind of initially thought, oh, this is nonsense, isn't it? But actually it's a very powerful, I do mindfulness sort of 3 to 4 times a week. It's in part of my care plans for every single patient that I see nowadays. And you can do mindfulness in various different ways. I've found that I like guided mindfulness. So that's the app that I use, which is called Insight Timer. There are lots of free apps. One's called Stop, Breathe and Think. The other one's Insight Timer. There are lots and lots out there. You just got to find what you like. But it's really very helpful. And there are increasing evidence showing that it improves your well-being. If you wanted to watch a program about it, there is a program from a couple of years ago called The Doctor Who Gave Up Drugs. And if you do type that in, there are 2 programs. They're both kind of based on children, but the first one is Mindfulness for ADHD. And that was a 6-week trial, which showed that actually the mindfulness really helped children with ADHD. And what you'll see, very funnily, there was a specialist psychologist following from Sweden, and she was pulling her hair out by week 1 because none of these guys were doing the mindfulness. But actually by week 6, they had made a significant improvement in their ADHD and concentration. So I'm very pro mindfulness. And I guess if you are lucky and you are based in London, there is this website, www.good-thinking.uk. This also offers mindfulness. It also offers computerized CBT for sleep. And that again is a really good website that I signpost people to if they are having problems. And of course, if you're lucky enough to be get it free in London. I guess other areas will do this in time, but not at the moment. But there are other places that you can go to. There are lots and lots of different resources that you can find online that can help. Next slide, please. And I think that's me done.
Okay. Thank you so much, Asif, for the wonderful, interesting talk. Very enlightening. It is indeed very thought-provoking to see how our world has changed, how COVID has impacted not only us, our health services, and all our practitioners, and how it's changing the future of healthcare. So we have a few questions. Unfortunately, we have only 2 minutes left. So before you answer maybe we'll try answering one question. But before you answer them, I just wanted to thank everyone for attending this session, and thank you for Asif for presenting such a useful talk. I'll tell you the questions, and maybe you can select which one you want to answer in a minute. So the questions we have are: do you think the virtual appointments or sessions for mental health are as good as they were in person? The second question is: what kinds of treatments or therapies are good for people affected due to COVID, whether it is stress, anxiety, or PTSD? And the third one was, I think it was on your last slide, how is the NHS planning to address such an increase in mental health difficulties? So you may just choose which one you want to. You just got 2 minutes.
Yeah, I mean, they're all very good questions, aren't they? So I think the reality is face-to-face. I'm going to try answer them all in 30 seconds on it. Face-to-face is absolutely the best, no doubt. And I guess I have the luxury that I'm an inpatient consultant. So I work in the wards. So all of my patients are face-to-face. So that's really helpful. But a lot of outpatients are now digital or telephone. Obviously face-to-face is the best, but I think second choice for me is digital, because I think you can get some nuances in regard to people's voices or their appearance that you can't get as well on the phone. So I would always choose digital over telephone, but patient choices, I think, is the most important. I think there's also something about risk. So if you're really worried about somebody, then crisis teams are still doing lots of face-to-face contact. But yeah, we're having to manage what we can. I think, Rena, the second question was around what kind of support.
Yeah,
so depending on how unwell you are, is depending on what kind of support you need. Yes. So if you are mildly unwell, if that's a good term, then I think things like mindfulness and exercise and structure and really focusing on your sleep can help. If you get to moderately unwell, you need to have sort of specific psychological treatment. And often we start off with CBT for anxiety or depression. And then that's where medication come into play. And how are we going to manage? The NHS is going to hugely struggle with the massive impact of referrals. So the only hope for it is increase the funding into mental health services, and the Royal Colleges and other people are trying really, really hard to get more money coming into mental health services, but it is going to be a struggle.
Okay, great. You just finished in time. So thank you very much for answering those questions. Thank you very much, everyone, for attending. And we're going shortly back into the main room. So see you all there.
Thank you.
Okay, bye-bye.